Bobbie, two important policy initiatives that have recently been shaping care, obviously the Affordable Care Act and the IOM Future of Nursing Report. Within these initiatives, what do you think are going to be the most important aspects that impact on nursing? So there, I have popped the ball up in the air. The IOM report, the ACA, bingo to Bobbie. It's yours.
So I'm going to share with you some thoughts I have about the Affordable Care Act and where we've come with the future of nursing. I also want to, of course, share a few biases I have and some crystal ball gazing about particularly education of the nursing workforce. But first I want to add a third policy initiative to the agenda, and I won't talk a lot about it, maybe Hyla will. As I think most of you know, on March 31st, the Nurse Practitioner Modernization Act, as part of the governor's budget, passed. And what that means for New York State is that for nurse practitioners who practice more than 3,600 hours, after they've practiced for 3,600 hours, which is about 2 years, with more than 3,600 hours of practice, will no longer be required to have written collaborative agreements with a physician or to practice according to protocols. And there's a number of other pieces of that legislation as well. But I would say, as one of a policy initiative that New York State nurse practitioners have been working toward for many, many years, I think this is a major milestone. I don't know if is Susan Apple in the audience? I know she was going to be here. No, I was going to have her wave her hands because I know she's been very active in that initiative. So that's that one, and we can talk about that later if you'd like. But the Future of Nursing Report, which of course is one of the more influential policy initiatives that we've had for a very long time, coming out of the Institute of Medicine, that was reported on and published in 2010. We held a seminar related to that shortly after it was published. That report framed the issues, I think, that have challenged us to take more leadership in health system reform, to ramp up our expertise in practice and education, and to advocate for policy change. And I'm sure that most of you know this, but just let me briefly remind you of what those key messages were. So the first one was that nurses should practice to the full extent of their education and training, and of course that's where the Nurse Practitioner Modernization Act fits in. Second, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progressions. That's the business that Columbia University School of Nursing is in, so I'll talk a little bit about that. Nurses should be full partners with physicians and other health professionals in redesigning the healthcare system in the U.S. Suzanne is going to talk about that one. And then effective workforce planning and policy making require better data collection and an improved information infrastructure. That is David. So I think we're going to cover the waterfront. So these were the primary goals of the report. And as I said, we're going to talk a lot more about that. But the third then policy initiative, of course, is the Affordable Care Act. So if you think about the major initiatives within that 900 and some pages of act that nursing should pay particular attention to, I think it's, and that's focused on the main themes in that act, which is quality access and health improvement outcomes. The opportunities for nursing are really many, but the three that I think we should focus on, one is the idea of expanded coverage, which is one of the big access initiatives. And that's both in terms of health insurance coverage, the health exchanges, and the expansion of Medicaid. Innovation in how care will be provided. This is really the language that supports a lot of the initiatives in education and practice about redesigning health systems so that nurses are enabled to practice to the top of their scope, whether they're registered nurses, advanced practice, doctoral prepared nurses. And then the third one is to focus on health promotion and prevention and particularly management of chronic disease. There's all kinds of other things in that act, but I think these are the three places. And I just want to say a few words about how the Future of Nursing Report and the Affordable Care Act are really form a synergy and enable us as nurses to move forward. So the IOM report was important because it provided the evidence base that is so important to policy change. And it raised the level of importance of concerns that we have had and have been voicing for a very long time. But the evidence and recommendations needed a platform. And I think that's the Affordable Care Act. So that there was the sort of the evidence in the IOM report, and then the opportunity, I think, is in the Affordable Care Act. So they're very, there's a lot of synergy there. While each opportunity is important in its own right, together they really provide that evidence and opportunity. But, you know, it's up to us to act, and I think that's what you'll be hearing about from our panelists. So let me just sort of project a little bit in the future and talk about what impact I think we could anticipate if we get this right. So I believe the impact is going to converge around a couple of areas. So first, I think I see an expansion of models of care such as nurse-managed primary care, particularly in the management of chronic disease. And David, in fact, has recently published a paper exactly about this opportunity, including talking about expansion of patient-centered medical homes with significant nurse practitioner engagement. I don't know if you're going to talk a little bit about that. Very good. The second major area is in the educational environment. And so here's what I think we ought to be thinking about. First of all, and I want to preface this by saying I think we are. I think we are thinking about this, but I don't think everybody is. So that is that we need to be thinking beyond advanced practice as managing patient encounters to managing a population of patients. Now that may seem like the same thing, but I think there's significant difference in manage a patient encounter as to thinking about managing a whole population of patients. So across care environments, across communities, across systems, policy initiatives, for example, and this really is going to take some policy savvy. So if you think about initiatives like obesity prevention, nutrition in schools, safe housing, safe environments, physical activity, violence prevention, and many others, these would benefit from the perspective of a well-educated nursing workforce with a unique understanding of how families and individuals respond to risks and opportunities for health within communities. So the approach being managing primary care as a milestone in a continuum of population-based efforts. So if you think within health systems, and Suzanne may talk a little bit about this, where an advanced practice nurse is really managing a population of patients across care environments, all the way to the more upstream view of population health, where nurses and communities are really thinking about a geopolitical group of people and what risks they're exposed to and how to provide interventions at that level. That's quite a long continuum, and we have opportunities all along the way, but they take, we'll need to be involved in ensuring that performance measures, I don't want to say a lot about this, you may talk a little bit about this, but performance measures that are so important today in capturing how well systems are performing in order to enable payment models. The same is going to, I'm quite certain the same will be applied to communities as well. So something to be thinking about in terms of education. The recommendation to double the number of doctoral prepared nurses, this comes out of the Institute of Medicine, and the nursing workforce, the baccalaureate as the entry into the nursing workforce. I think these will assist in our efforts, and we may want to discuss that a little bit later. I also think we'll be shifting from assuring competencies related to time in education to competencies related to assuring the outcomes of the competency is met. So medical education is looking at this, nursing education is looking at this, the other health professions are looking at this. It's a shift from time in education to assuring competencies within education. It's a very different way of focusing. I think we'll be looking at the utilization of technology as an opportunity rather than a burden. The opportunity to understand the health of a population of patients, either in a system or in a geopolitical environment, is dependent on large data sets, and the ability to access that data and make sense of it is an important competency in the future of our nursing workforce. Our nurses in the future will not only need these skills, they need to design these systems. Interprofessional education is a must. We're a little slow out the gate on that one. George Thibault of the Macy Foundation has written a lot about this, and I read recently something he said that I think was significant, which was that interprofessional education has the opportunity to be effective in reducing dominant attitudes such as biases and lack of understanding among disciplines. And he feels that IPE will serve to increase the respect we have for each other and the shared talents, both individually and shared talents of professionals. And then finally, I think we need to seek opportunities for postgraduate residencies for our advanced practice nurses. I feel very strongly about this. It's an opportunity to extend that competency into the practice environment. I also just can't leave this without putting a pitch in for a redesign of payment models that currently have resulted in a lack of parity for the performance, the same service as other providers, but not getting equal pay. And then finally, we need more education about system-savvy thinking. I see that now in our students, particularly our doctoral program, but I think we need a lot more of it. So with that, I'm going to turn it over to David.
Bobbie, I get to ask a question.
You're the boss.
And thank you for a great survey. As a legislator, I was the author of the Advanced Practice Act provisions in 1987, and currently sit on the Board of Regents. So we will be looking at the implementation of these changes that were in the law, or in my view, long overdue changes. I must say, reading the statute, I'm still trying to figure out how some of it works. But thank you for mentioning that, and thanks for that great oversight.